The big battle for reproductive rights in New Orleans is being waged over one clinic, and it hasn't even been built yet. Planned Parenthood has been fighting to build a new $4 million clinic that will offer abortion services along with a range of other health care like cancer screenings and STD testing. And it has faced just about every obstacle imaginable, making us question just how legal, or at least how available, abortion really is in New Orleans, Louisiana. A news story for Cosmopolitan.com details some of those obstacles, including a particularly troubling incident in which anti-abortion activists interrupted services at a Unitarian Universalist church because the church has celebrated the clinic's groundbreaking. Protesters went so far as to hold up graphic pictures of bloody fetuses against the windows of the church daycare, which was full of small children. Joining my panel is the author of that piece, Jill Filipovich, who is senior political writer for Cosmopolitan.com. I just want to put out there, that is the church that I attended in New Orleans. My kid was, once a young person who may have even been in that, room, although clearly wasn't when this happened. So talk to me about what kind of resistance this clinic has been experiencing.
Sure. So this clinic has really gotten pushback from every level in New Orleans. A lot of the folks that are actually on the ground and live in New Orleans are very supportive of it. They realize that Louisiana has a whole slew of healthcare challenges and they want this clinic built. But you've seen a lot of folks, especially from the outside, so organized anti-abortion groups, as well as the Catholic Church. The Catholic Archdiocese wrote a letter basically saying that anyone who works on this clinic, so any construction worker, contractor, vendor, will be blacklisted from future church projects if they help build this Planned Parenthood. And then you've also seen the Louisiana State Legislature pass a whole series of restrictions on abortion access that a lot of pro-choicers in Louisiana are saying really give cover to the kind of anti-abortion actions that are happening on the ground in New Orleans.
Yeah, and it feels to me like this is the other side of the trap stories. We've been reporting on trap laws for a couple of years now. You have to have facilities that look like this and do this. And so in this case here, they're going to build a facility that would do all of those things, and they can't get it built because of this resistance.
Yeah, and then what happens, it makes Roe not a reality for and out of reach for the communities that need it. We work a lot in a place like Texas that Erin has done a lot of work on, and we're seeing more and more laws in place to essentially eradicate the clinics in the state and across the country. So it makes it harder for women. If a woman is able to get the money, the transportation, take time off the work, get the child care to drive to the next state or drive miles and miles to the next clinic. For the women we work with, immigrant women often have to pass an immigration checkpoint. So these kind of barriers that exist, these kind of regulations that are in place, the agenda is to chip away at the right to reproductive care in this country.
Strategically, it's so interesting because both the guests that we had in the previous block and this sort of underline the fact that the anti-abortion movement in 42 years has not been able to talk women out of needing abortions. Mm-hmm. It has not done anything about the demand for abortions, the choices that people are making in their individual lives. What is incredibly effective in ending abortion is ending access to safe abortion, making it really, really hard to open a clinic, to go to a clinic, to afford an abortion, just like HR 7. And that takes the choice out of the woman's hands and makes it an absolute impossibility, at least a safe and legal one.
It's interesting when you use that language of safe. I mean, Jill, I'd be interested in whether or not when you were doing your reporting there, if people are talking about this. We heard from the attorney this language about botched abortions, which just are extremely unlikely in circumstances of a medical abortion, that a surgical abortion that occurs for the vast majority of people in the first trimester. But when we do start making access harder, it does become more possible.
Absolutely. And I think you're seeing that in Texas. I also did some reporting from the Rio Grande Valley and talked to women, who have said, my friend had an illegal termination because she couldn't access abortion here. It's very scary to think about that happening, throughout the United States. Louisiana was voted by the American Life League as the #1 pro-life state in the country. Louisiana also has
more than Mississippi?
More than Mississippi. And it's held that honor since 2012. And I think given its sort of long list of anti-abortion laws, that's probably accurate. But you also look then at the fact that Louisiana has some of the highest rates of teen pregnancy, highest rates of STDs. They have a 58% unintended pregnancy rate. You have these groups talking about how Louisiana is so pro-life, but they're really not doing much to help women or to help children in a state that has astronomical, poor health outcomes, high maternal mortality, and high infant mortality. So I think really interrogating what that term pro-life means. Does it actually mean supporting the health of women, children, and families? Or does it just mean really attacking abortion rights and then making abortion in women less safe? And that's what I think you're seeing on the ground in Louisiana.
Yeah, to me, that is part of the difficulty for me, Robert, is I actually understand why people can have very differing opinions on this and have a position of belief and, you know, faith-based opposition. But what I do find consistently surprising is the extent to which that becomes, not for all, but for some and for some of the most vocal, the only thing they're talking about relative to women's health and children's health.
The frustrating thing for me, I'm obviously not a female, so I'm clearly a minority here at The Voice, is that I don't know, and I said this during the commercial break, how many pro-life women are part of this conversation to try to find some type of common ground. I would ask both of you as reporters, how many pro-life women did you speak to in Texas and Louisiana and so forth that influence your reporting? I mean, in other words,
Erin hangs out with them. She rides around with them in the scary vans.
But what we saw, and we talked about this over the commercial break, what we saw in Washington, D.C. a couple of days ago, I believe this, tens of thousands of women, pro-life women that were marching for life. And so the question, and I also would also point this out, in Texas, in Louisiana, in Mississippi, and so forth, these are elected officials making policy. Those elected officials stood before their constituency and I said, I believe this is what I believe, and they were voted in. So therefore, this is not just people in these ivory towers
right, granted,
that are making this decision.
But I would say you want to be careful with the voted in on people's rights, because I'm just saying. I think we all know where many of our rights might be if they were on the ballot. Thank you to Robert Trainum and Erin Carmone, to Jessica González-Rojas, and to Jill Filipovich. And by the way, if you want to know more and read Jill's reporting about these efforts to block the Planned Parenthood clinic in New Orleans, go to cosmopolitan.com. That's right, Cosmo. Her story is online right now and very much worth the read.